Hi everyone, so this is the WithHealth baseline training video. I'm Joanne, I'm one of the nurse coordinators, and this is Mark Estock, also one of the nurse coordinators. So we're just gonna do the 30-minute baseline video training. Hi, I'm Nurse Joanne. I'm here to help you with your COVID test kit. Did you receive the kit in the mail?
I did, thank you, Joanne.
Oh, perfect, great. Go ahead and open that box. And as you remove things, I want to talk you through it. So inside that box, you should see a small green and white box that says WithHealth serology on it. As soon as you find it, go ahead and pull that out, please. Perfect, yes. So go ahead and open that package. And what the serology is it lets us know if you have the antibodies, like if you've had the virus in the past. We've had a lot of patients tell us, oh, I had the flu in January, and then we do this test and it shows up with some antibodies. So we tell them, nope, you really had COVID before anyone knew what COVID was. All right, cool. So now that you've got that box open, go ahead and take things out and I'll describe them to you as you do that. So go ahead and pull something out. I'll tell you what it is. Cool, so that's the buffer solution. Go ahead and open that up and uncap it and put it off to the side. Remember, that's the buffer solution. All right, go ahead and reach inside that box. You should see another Ziploc with purple. Perfect. So go ahead and open that up. I just want you to take out one of those little purple lancets. This is what we use to poke the skin so we can get a little bit of a blood sample. Go ahead and remove alcohol swabs. Yeah, so that is a pipette, and I want you to take a look at that pipette. Do you see where the black line is?
Mm-hmm.
That's how much blood you're going to need, okay? So with this pipette, in a little bit, I'm gonna have you poke your finger. And the way this pipette works is I'm gonna have you squeeze enough blood so that you have about the size of a ladybug on the tip. And you're gonna let the pipette just barely touch the blood and you'll watch it automatically suck up into that tube, okay? So you're gonna have to do this a couple of times until the blood goes all the way to that black line. All right, perfect. So you have it off to the side?
Mm-hmm.
All right, very good. So there's another thing that's inside. Yep, you'll need one alcohol swab. And there's another package inside that box called, it's the cassette for the COVID tests. On the cover of that packaging, it says right sign. Go ahead and tear it open and remove the test cassette. Go ahead and take a look at it right now. Very good. So it says COVID-19 on top. At the bottom, there's a little area that says the letter B. That's B for buffer solution. So you'll be putting 2 drops in there later. Not now, I'll let you know when. And right above it, there's a square that has the letter S. That's S for sample. That is where you'll be putting the blood, okay? And right above it, it tells us what your results are. Very similar to a pregnancy test where you'll see a line develop. If a line develops on the letter C, that means you are COVID negative or COVID naive. You don't have any of the antibodies or did not have the virus in the past. If a line develops on IgG, it tells me that you did have the virus and it's waning or leaving your body. And IgM means that the virus is still lingering in your body, okay?
Okay.
So let's go ahead and take care of this test. It's gonna take us about 3 to 5 minutes to get a result. So go ahead and rub your hands together, get them nice and warm. And I like to recommend the ring finger for this. So I want you to take a look at your finger. Do you see where the fingerprint is? And there's that little swirl right in the middle.
Mm-hmm.
That's where I'm going to have you press that purple lancet on. Okay, so go ahead and clean your finger. Wipe it off with the alcohol swab. Very good. Remove the white cap from the purple lancet. And whenever you're ready, I like to have people just press their hand against a table and then just press the lancet against their fingertip. So it's just a little poke, little snap, very good. So go ahead and hold your hand horizontally, and I want you to milk your finger from the base all the way to the top. If you pinch on the top, you're just gonna stop the bleeding, and you're actually gonna need a good amount of blood. So when you've got a good drop, go ahead and take the pipette and let it just gently, barely touch and watch it suck up into that tube.
It's not enough, so I keep pushing for blood?
Yeah, so just keep milking that finger you honestly will need anywhere from 2 to 3 drops of blood to do this test. And as soon as you get the blood all the way to the black line, let me know. Okay, so just keep milking from the base all the way to the top of the finger. Are you almost to the black line?
Almost.
Okay.
Okay, let me just grab a tissue here.
Yeah, you can use that, or you can use the,
Okay, so got it.
all right, perfect. So I want you to squeeze that blood sample onto the letter S of the COVID cassette.
Okay.
Once you do that, I want you to take that white vial, the buffer solution, and put 2 drops into the letter B. Okay. It's going to take about 3 minutes for a result to come up. So right now, I'm just going to have you put this off to the side. And I want you to take out the, we're going to do something called a PCR, or nasal swab, okay? The COVID serology test lets us know if you've had the virus in the past. The nasal swab will let us know if you actively have the virus right now, okay?
Okay.
So you can find the nasal swab wrapped inside the FedEx envelope. It should be in that package, so go ahead and unroll that. And in the email we sent you, we asked you to have a cup, a ballpoint pen, and some tissue available. So if you can put that cup right in front of you and just have that pen nearby. Perfect. Okay, very good. So as you unroll that, you're going to see a plastic bag with a paper. Go ahead and take that plastic, and I want you to reach inside and take out that paper because I need you to verify some information first.
Okay.
Okay. So just make sure your name is spelled correctly, everything is spelled correctly. If there's anything that's wrong, please let me know because I'll need to correct it on my side.
Nope, everything's good.
Okay, so on the middle left-hand side of that paper, you're going to see collection date and time. I need you to write today's date and the current time.
On which side?
It's on the middle, like halfway down that paper on the left side. It says collection date and time.
Okay.
So just write today's date and the current time.
All right.
Right, so once you're done with that, go ahead and fold it in 4s and put it back inside that plastic bag.
Okay.
Okay.
Yeah, give me 1 sec, guys. Have to grab something.
All right, perfect. So in that same packaging, you should see the nasal swab kit. Perfect. So on top where it's yellow, it says pull. So go ahead and just pull those 2 pieces apart. Just open the first 3 inches, just enough so you can reach in and grab that green specimen container. Okay, put that swab down off to the side because I need you to write your first and last name on this tube. Okay, whatever name is on that lab paper that I had you write on, make sure it your first and last name matches on that tube, okay? So if your name says Nicholas on that paper, don't write Nick, write Nicholas, all right?
Okay.
And also please write your date of birth.
Okay.
So right now, go ahead and hold that tube vertically. There's a solution inside that tube that we need. You can't spill it or lose any of it. So go ahead and remove the green cap and place it right side up so it doesn't get contaminated. And then place that tube inside the empty cup, okay? We just have you put it into the cup so it doesn't topple over and we don't lose that solution. All right, so what I'd like you to do now is reach for that swab. Okay. And I want you to see where there's a little red line right in the middle. Perfect. So put your thumb and pointer finger about 1 inch below the red line, okay? Now, before you do this, I want you to look at me because I'm gonna have you watch me first before you do this, okay? Give me one moment. Okay. So like I said, you've got your thumb and pointer finger 1 inch below the swab, okay? You're gonna move to your side, tilt your head back, and keep your mouth open. And you're gonna breathe in and out as you do this, okay? Because as you breathe in and out, it desensitizes or decreases the sensation of a foreign object going into your nose, so that'll help. So you're gonna tilt your head back, keep your mouth open. You're gonna slide the swab into your nose and angle towards the back of your throat. And then I'll tell you when you're at the right spot. When you feel like you're going to sneeze, cough, and tear up, know that you're already there. And then once you're there, I'm gonna have you roll, swirl the stick for 5 seconds. I'll count with you. 5, 4, 3, 2, 1. And they'll have you pull out and then place inside that specimen container, okay? So whenever you're ready, I'll have you do that, and I'll let you know when you're at that location. All right. Perfect. If you feel a little resistance, kind of roll the stick. Oh, wow, you did great. Okay, so you're right there. Go ahead and roll for 5, 4, 3, 2, and 1. Slide out. Very good. You're gonna tear up and cough and sneeze a little bit for the next minute or so, okay? Know that this is normal.
Oh.
Yeah. So just keep in mind, this nasal swab will let us know if you actively have COVID right now, okay? Go ahead and place the green cap on, twist it on tight. And you'll just be a little teary-eyed for the next minute. Now place this tube inside that plastic bag that has all of your information on. Perfect. So it's in that plastic bag. And then you're going to peel open or peel out the blue strip that's on the top.
Mm-hmm.
Place this inside the FedEx envelope. Okay. And then turn that envelope around. There's a tracking number on the bottom left-hand side. Can you please read off that tracking number to me? I need to write it down.
On the right,
the bottom left-hand side.
7910 8105 1505.
1505. Got it. So please make sure you mail out this envelope to FedEx before 5 p.m. today.
Okay.
Okay, yeah, if you're unable to mail it, then unfortunately we'll have to retest you again and send you another swab. So please make sure you mail this immediately to FedEx. Okay, so we're almost done with our appointment. Inside that test kit, there's also a thermometer and something called a pulse oximeter.
Okay.
So we're going to multitask this a little bit just because this particular thermometer takes about 30 to 45 seconds to get a result. So what I'd like for you to do right now is take your thermometer, just tap it once, okay? And then I want you to hold down that power button for 8 to 10 seconds so it'll turn to Fahrenheit because the default mode is Celsius. So if you just—
It turned off when I pushed it again.
Okay. So go ahead and turn it on and then just hold it down for about 8 to 10 seconds and it'll convert to Fahrenheit. Okay, in the event it doesn't, we can just take your measurement with Celsius and I can convert it for you.
Okay.
But whenever you're ready, go ahead and place it underneath your tongue. All right, and like I said, we're going to multitask, so you can just kind of keep this thermometer in your tongue. And right now what I'd like for you to do is go ahead and take the pulse oximeter, peel that plastic off, turn on the power button, and then I'm going to want you to just pinch one side and let your finger slip into it, okay? You can use any finger except for the thumb, and we're going to give it about 5 seconds. On the left side, you're going to see something called saturations. You just want that number to be between 92% to 100. That lets me know if you're getting enough oxygen. And the number on your right is your heart rate. So ideally, you would like that number anywhere between 60 to 100. If you're a young athletic person, your heart rate might be a little on the lower side, and that's normal if you're athletic. All right, so what number do you see on the left side? Oh, sorry. Did your temperature read? Let's see what your temperature shows.
98.5.
Very good. All right, so what number do you see on the left side of the pulse oximeter?
99
Perfect. And what about
and
the on the right?
73.
Perfect. So 73 is your heart rate. Perfect. Thank you. So when you go to work or when you go on set, please make sure you bring this pulse oximeter with you and this thermometer. So if you're not feeling well that day, you have these tools to check to see what your vitals are.
Okay.
Okay. So just a friendly reminder, please mail out that envelope to FedEx before 5 p.m. today.
I will.
Otherwise, you'll have to repeat that test again. Right. Thank you. Thank you very much. And you have a good day.
What about my thing?
My apologies. My apologies. Let's go ahead and read the results of this. So if you can hold that cassette to the camera and I'll read it for you and let you know. Okay, a line developed on the letter C. Go ahead and move it towards the center or move it that way more. Okay, cool. So yeah, a line developed on the letter C. That means you are negative, you are COVID naive. You've been doing a great job at sheltering in place, quarantining. So thank you very, very much. Continue to do that. So
Thank you.
reminding me, is there anything else I can help you with? You can just throw
I think that's
the rest
it.
of the test kit away.
Okay, cool.
Thank you very much.
All right, thank you.
You're welcome. Have a good day.